Now, going back to my theory that you should use a bonding system, adhesive system that is made by the same manufacturer as the composites you pick. I chose for all these cases Optibond Universal Bicurve, and this is a 7th generation composite, which are the newest composites of adhesives, available on the market. It is a single bottle system, and it can be used with self-etch, selective etch, and the total etch technique. I personally, when I do anterior and posterior restoration, I still believe in the total etch technique. I know that many dentists have gotten a lot of beautiful results with the self-etch or just the selective etch technique, but for me, total etch is king. That being said, if you choose a composite that is made by a different manufacturer, please look for their 7th generation bonding system that would match it. And these are truly the key things that you want to check before purchasing that system. That the bond strength should be between 20 to 30 megapascal. I think that is the standard of a really good dental adhesive in today's market. That the film thickness is extremely thin. You don't want to add thickness between your tooth and your composite. That your adhesive is tolerant to moist or dry environments. So if you over dry, it still works great. And if you leave it a little too wet, it still works great. That it's available in light cure or dual cure formations. That it helps minimize post-operative pain, which is an issue that I told you I haven't had before. And it comes in bottle or unit dose delivery. I think bottle system is a better financial choice, but you need to make sure that your assistant closes the bottle properly all the time after they dispense it, because I have noticed, at least mine, that sometimes they just put the cap on. They don't screw it on, so the ethanol out of the adhesive will evaporate, and then you have problems with the adhesive. So if you have assistants that aren't very careful, the unit dose delivery is for you. Now, let's talk about the material that I picked, Harmonize. It's a nano composite infused, nano hybrid composite infused with the ART adaptive response technology. It offers seamless aesthetics, truly beautiful, and it has characteristics that mimic enamel. It has a beautiful chameleon effect, and it's super easy to handle. It does not stick, and because it's a nano hybrid, it's super strong and it lasts a long, long time. Now, this is an example, again, of Harmonize that I have picked to show you. Again, this is immediately after the procedure. Patient came in with a peg lateral and wear on tooth number 10. Her father is a well-known dental technician, and surprisingly enough, he did not want porcelain on her daughter's teeth, so asked me if I place a really good composite on a tooth by just etching it without preparing the surface. And this is exactly what we did in once. So although it looks like it would have been layered, like I told you earlier, it's very easy with the right material to get really good aesthetics.